Welcome, everyone. I'm Jessica from WCWI, and today we're really just diving into the results of the 2025 Employee Wellbeing Trends Report, which was a collaboration for the second year with Motion Connected. We're really excited just to kind of explore some upcoming trends from employers across Wisconsin and other areas, and kind of hear your feedback, what you're doing, what the trend report said to you, and what kind of stood out to you. So I'm joined by my co-host Sarah here from Motion Connected. So thanks for being here. We're really excited. And we're lucky to be joined by all three of you amazing professionals who are on the front lines of well-being in your organizations doing the work. So I'm going to let each of you just do a real brief introduction, maybe sharing your role, how long you've been in well-being, a little bit of your connections.
Absolutely. Erin Schad here. I'm a wellness program manager with Kohler Company. I've been with Kohler for over 9 years, and I've always overseen the wellness program since inception. However, I've been in corporate well-being for almost 20 years. So I've been very fortunate in my career to always work within the corporate well-being space. And so excited to talk a little bit about how Kohler is trying to pilot some new things and support our community and our people.
I'm Linda Golick. I am with Amplify Health by Bellin. I'm the health and well-being consultant. That involves being a person that works with employers that we are connected to, that we have relationships with, helping bring health care easier to their employee populations, and then also just trying to do health education out in our community to really help get everybody healthier that we're serving. And I've been with Bellin 5.5 years, but wellness, I've had my hands in wellness for probably 30 years. So it just kind of lives in me.
Alicia Perrin. I am from Southern New Hampshire University. I'm the Employee Wellbeing Program Manager. Been there for over 8 years now, but really just in this role for just over 4. So it's relatively new at SNU. And really just working with all of our external stakeholders, the platforms that we have, promoting wellness and bringing wellness education to our staff, and then really just trying to boost engagement of all of the resources that we have. I'm very happy to be here.
Awesome. Yeah, thanks so much for joining. I love the different representation we have between different industries, different locations, regions. I think it's going to be a really awesome conversation today.
And what a combined amount of experience we have. That is amazing.
Yeah, true. Sarah, do you want to dive into just kind of some info about the trend report, a little demographics, just to kind of set the tone?
Yeah, definitely. For those of you that are looking to access the report, you can find it on either the Wellness Council of Wisconsin website or Motion Connected's website. This is the second year for our two organizations for working together on the Employee Engagement and Wellbeing Trend Survey. Our goal, I know, as we started to look at doing this together, was just to be able to identify key insights of what was working well in the space for employers across the United States, and then to be able to bring that back in a more formalized piece of content that we could share with our organizations and members that we work with. So it's been a very exciting process to be able to do this together. This year we had over 200 respondents, and that was ranging from businesses small and large, and a lot of different industries. I think our number one industry was manufacturing, but we have education, healthcare, professional services, nonprofit, all contributing to the survey. And the participants or respondents of the survey were a lot of human resources, a lot of wellness professionals, but there were some C-suite professionals, some brokerages that participated. And so we have compiled all of that together. And today, we're not going to review the entire report. Today's idea is let's just touch on a few key points And then have our panel weigh in on, our very experienced panel, weigh in on what they see and their thoughts on the highlights.
Perfect. I know it's really cool that we have been in the second year of this report, and it will grow every year that we do it to be able to have that comparison of the true trends and what we're seeing. So just to kind of dive in, the very first kind of space is that top driver, why organizations are doing wellness. So top driver for wellness programs is emotional mental well-being. So the top mental health initiatives that we saw were EAPs, flex schedules, so like slow return to work or flexible flex time, and then others like mental health and stress management education. So the first question I'd love to hear is if mental health and emotional well-being is a top priority for you, how are you addressing it?
Yeah, I mean, that's definitely been a top concern, both for us as an organization and definitely our employer partners. I think that, the COVID pandemic really shined a spotlight on something that had been existing for a very long time that we now just feel a little bit more apt to talk about, and people are really concerned. So for us, a couple different things that we have going on that I think are just some non-traditional things that we've been doing to try and just put some extra resource out there. We know that the shortage of providers is very real, and that is not something that is changed overnight. We do have a partnership now with Marquette University where we got a grant through an organization that we're going to have a partnership to train up some folks to become those behavioral health therapists for us, just to try to decrease, that shortage. For us in our department, a couple just non-traditional things. I do a podcast called Mental Health Moments, where I'm lucky to have kind of a couple of different behavioral health therapists that we just have conversations and we just talk about what's trending, what are people concerned about, what are some coping mechanisms, what are some tips and tricks. We put that out, of course, for our own employees to access very easily. Podcasts are just a way that all of us are getting information these days. And then also it goes out to our employer partners. So it's just kind of that extra layer of here's another thing, here's another resource. The other thing that we started a few years ago that really can aid mental health, we have a program called Coaching and Culture. And that's actually a wellness coach that our employers, it's something that they can purchase and they can have access to this wellness coach. And it doesn't have to be just physical health and well-being topics that people talk about. If people want to talk about how stressed they are at work, she's going to help you with that. If you want to talk about how your work is burning you out, she can help you with that. So it's something just a little bit different than thinking about that traditional have a therapist, get people to EAP type of thing, but also kind of reduces then the stigma of people that don't feel comfortable necessarily reaching out, to a counselor or to EAP services. So just a couple of things that we've been working on.
I'd be happy to share. I think at Kohler, we have been fortunate to be on this journey since 2019. We actually started with a consultant. Many of you know Medi Spees. She leads A World Without Suicide. And we partnered with Medi in 2019. So we were a year ahead of the pandemic, but boy, did that hit hard. But it really started with developing protocols and guidelines for everyone to follow. We have such a diverse population between our admin, manufacturing, and hospitality that while we still do programming that really can hit different pockets of the population and meet them where they're at, making sure that you have a baseline as far as what are your protocols, how are they embedded with your safety team, your security team, right? Because otherwise all of these departments have their own set of rules. And so when they come across someone that's going through a mental health crisis, they might not be leading with empathy and looking at it from a mental health perspective. They may be looking at it simply from a safety and a security perspective. Now, those things are still important, but how do they all live together? And I truly believe that starts with your protocols and guidelines. So we started that in 2019. We actually just redid it this last year. It took us about a year and a half. We worked with another vendor that we already were partnered with, and we globalized it because, of course, Kohler is a global organization. So we launched that in February. It's called our Mental Health Leader Guide. And we also did podcasts. So we had leaders that did different podcasts. We had 4 quarterly podcasts that were launching throughout the year. We also took the guide and did a training and also broke it down into short nugget videos, right? So if you're encountering a very specific situation, you can go to our learning platform, which is where this is all housed, and you can access that short 3 to 5 minute video to help you in the moment. So I do think that that was a strong building block for Kohler. And I know I've spoken at length with WCWI on the varying ways that Kohler has supported mental health. So I could talk about this all day. But that really was the big building block for us. And I encourage all organizations to start at that point rather than just, adding a training in during the year, which is still very important and valuable. But how do you build the building blocks first and then go up from there?
Well, those are very hard to follow. Those are fantastic answers. But yes, at SNHU, mental well-being is definitely a priority. I think coming from COVID, that's how my role began. So I've only been in my current position for just over 4 years. It was kind of a response to that. So just having someone to kind of wrap their arms around wellness in general has been a huge, it's just been such a positive impact on the university as a whole. Every May we do, of course, have Mental Health Awareness Month programming where a lot of policy procedure trainings about, if there is an employee or a student in crisis, what does that look like and what are the steps that you would take to make sure that you are providing the care and empathy and support that you need while still staying within your role and boundaries, as an employee. We've also rolled out Wellbeing time, which is just kind of an additional PTO kind of incentive, but just kind of giving that, it's almost like giving permission for people just to take some time for themselves. I think just labeling it something different can just like a mental shift where it's like, no, I just need a day for me. It's not PTO, it's not sick time, but it really is just a well-being day for me. So we rolled that out last year, and I think that had a huge impact as well. And just some coffee chats. So a little less structured from a podcast for staff, but just having a very casual coffee chat around mental health and different wellness topics. In May, it was solely focused on mental health and just, there was no licensed professionals, but we had 200 employees show up. And it was just super engaging conversations, definitely offered a lot of validation for just common things that people are going through. So just holding that space for staff, I think, was so valuable in so many ways. Just doing that one small initiative, I've gotten so much positive feedback. But I think people just want to share their own stories and experiences and talk to their peers and not have it always be so clinical, but just having those spaces for staff. So always trying to find new ways, but those are some of the things that come to mind.
Thank you. That was a really nice blend of strategy and unique initiatives, and kind of listening to the needs of your population, right? And being able to shift and move as needed. I am curious, we've heard a lot about what you're implementing. Was there anything you've changed or shifted or stopped doing that really wasn't working, or a roadblock you came into?
Definitely one thing that we've tried to step away from is just being super webinar lunch and learn focused. I think over the last couple of years, and some of the feedback that we've gotten from staff is that there is just such a Zoom fatigue that people are facing. Employees feel like they don't have enough time in their day. It's another way for them to just be in front of their computer, and everything I try to promote is like, if you have free time, get away from your desk, like step away from your computer, go outside. So just having webinars and lunch and learns and just like super content heavy sessions, kind of just, it goes against kind of the message that I'm promoting. So I have tried to just move away from webinars and live sessions. And when I am planning events or activities, I've shortened them. So they're maybe like 15 to 30 minutes, and they're more action-based. So as part of the mental health awareness programming, there was one session where it was just a 30-minute lunchtime walk, and I put this on my LinkedIn too, just like a picture of it, but we came into the meeting and then I just had a PowerPoint slide up that said, this is not your average meeting, go outside, step away from your desk. So it was like time dedicated on their calendars where they all felt like they had that permission to join and participate, but I was like, go, like leave and go, get away from your computer, go outside, take a walk, get some fresh air, just do something for yourself during this time. And then when you come back, just drop in the chat how you felt or what you did. And the response of that, just such a silly initiative, was overwhelming. They were like, thank you so much for this time. I feel so good and refreshed, and I got time with my dog, and I saw birds, and just hearing nature. And that was like, wow, like you guys can do this on your own. Like you can schedule time during your day. But I feel like most people don't do that. So just having that kind of dedicated time was so impactful. So just, yeah, moving away from those live sessions where we're talking about how exercise can impact your mental health, and instead just going out and doing it and living it, and then kind of reaping the benefits right then and there, instead of learning about it. So that was one shift that I think we're going to continue to move towards in the next couple of years for sure.
I would build off of Alicia's kind of topic of social connectedness. And I would say that's been a strong focus for me in my programming planning over the last couple of years. There's no secret that, we know now that social isolation is almost as harmful, if not more, than cigarette smoking and tobacco use. So that hit me very hard at the tail end of the pandemic. And I knew that we needed to, again, similar to you, Alicia, get people away from their computers. I still have to offer that because now we have a wider reach of people that we never had before when we did only do in-person programming. So now it's that healthy balance of both, but being creative with it. So doing leader-led walks during National Employee Health and Fitness Day. We just launched an internal recreation program this fall. And so we're creating more social connected opportunities that aren't just based around physical activity, but common interests, such as clubs and social events. So that's been really helpful for us. I would also add that one other, if you're a wellness professional watching this, if you are not in tune with your community needs, I encourage you to reach out to your local health department, any other coalitions that exist, and take the step and become a member. I'm a part of too many groups in our Sheboygan County, which is where our headquarters are, but two of which are specific to youth mental health, and then a mental health coalition for the county. And I've made it my goal to try to take a lot of the community resources and communicate those in my newsletter, our internal social media page, because people don't always feel comfortable participating in company-sponsored mental health events. And we have to recognize that and meet people where they're at. So if there are community-free resources happening, which most likely there are in your area, then lift those up, right? Be a community partner, help them. They will then come help you. And it just becomes this beautiful organic partnership with all of the community resources that you have access to.
Great tip.
Yeah, I absolutely agree, Erin. I think, boy, that social connection piece can just take place for people in so many different ways. And we do know the research is telling us that people are feeling more isolated. The virtual worlds that we now have to live in are causing more loneliness for people. So just all of us being so conscious of what do people really need? What do they really want? And just even aiding them and knowing that there's different ways to connect with people in different venues, whether that be in the community or in your own work team and those types of things. The other thing that came to mind for me, something that we really stopped doing and something that also our employer partners, they still exist in some places, but more and more are shifting away from those health risk assessments. We don't see the data does not show us that those really are motivating, having people know their cholesterol and BMI and things. Certainly that's a component of health and well-being, but it isn't motivating. And it causes shame in individuals to be, put into that. And people feel like they have to starve themselves before they go in for health risk assessments and things like that. Well, that's a mental angst that people just don't need in today's world. So we've actually stepped more into recommending wellness certificates where people are just getting their age appropriate screenings, making sure that they're connecting with their providers just to keep up on their own health and well-being, deal with any chronic diseases that they may have. And I think that's a much gentler, softer approach that keeps that human being at the center of what they really need in terms of where healthcare can begin, and then hopefully is less stressful for them on the end as well.
That is amazing insight, Linda. I think Jessica and I spent the 15 minutes before this call wondering and talking about HRAs and biometrics and where do they play. The trend report indicated that 65% of the respondents were currently still doing biometrics. It was maybe the fourth from bottom of all the things offered. I mean, on-site was below that. Fitness and gym reimbursement was even below that. But yeah, if you guys have any, amongst the two wellness coordinators here, are you still doing them, still finding value? What are your thoughts?
Yeah, so that is the question of the hour, right? Along with GLP-1s, let's talk about prevention. Yeah, so we did offer them this year, this program year. However, my goal is to move away from them. Right now, they're offered as more of a supplemental free benefit because in 2023, we strongly shifted our incentive design to preventive annual exams. That was something I felt very strongly about with coming off the pandemic, people not going to their doctor. I had a personal experience of going to my first primary care appointment after the pandemic, and I had 2 family members that passed from different chronic conditions that my family history had to be updated, therefore changed the trajectory of the types of prevention I needed and the frequency. And so that was a catalyst for me to say, we need to change our design, and people aren't going to love it. We are going to force the hand a little bit to get people into their doctor, and we allow all different kinds of preventive screenings to be completed. But it's not the biometrics or the health screening. It's not just the blood work. You need to go in and have a face-to-face conversation with people. Now, we're also exploring next year looking at some virtual options, which again is not the golden ticket, but we're trying to consistently meet people where they're at. And if they're having a conversation with a practitioner and they're asking the right questions and getting that information, that is very important to us. So I'm fully on board with prevention. We're actually doing a sweepstakes right now called Prevention is Power. So prevention is everywhere here at Kohler.
Yeah, and just the data shows us we actually even have data supporting now it saves our healthcare system money by getting, it saves us money, it saves the patient money. So it's really win-win by getting people in early and doing those preventative screenings. We all know probably someone that has been affected by cancer, and that becomes really costly in a lot of different dimensions of well-being. So if we can prevent that, that's ideal. That's ideal. So in our department, we talk about saving lives before they know they need saving. It's all about prevention. And so what can we do to get those people into those provider offices, having those conversations, and then letting the provider and the patient decide what's appropriate for me. Where do I feel okay, maybe getting my cholesterol checked, really just having that personalized healthcare that's so important for everyone.
I think sometimes we forget too about the other intangibles that happen during those appointments from an SDOH standpoint. So you get questions around your safety. Do you feel safe in your home? Do you have access to nutrition, healthy foods? And are you, just those types of questions. Mental health, that comes up now. Very strong conversation with my provider. And at the time, I wasn't doing great. And so it was that conversation. Do you have access to the resources that you need? And those are things that we don't always talk about within the preventive screenings. And I can do a better job of that. I'm just having this aha moment now. So I think those are things that we need to encourage as well for people, because they don't always stand out when we promote preventive screenings.
Absolutely. Yeah. That's such a priority for our healthcare system as well, that patients come in and they fill out questionnaires, and that's exactly what gets flagged for an individual. So we can provide and share potential resource to help with that, because we know that those social determinant of health factors are absolutely affecting people's health down the line. So if we can get really upstream and start to prevent some of that and get people the resources they need earlier, that's going to help everyone be healthier, and it's going to infect entire populations if it's done and carried out effectively.
You mentioned social emotional connections. You mentioned preventative exams. When we're looking at the trend report for initiatives, the top initiative is the activity challenges. So getting people together to do things together. And the second is preventative exams. So I think it's in alignment with what we're seeing from our population's needs. And it's translating to actual initiatives within the programs, right? Of like, people need connection, and we need that more in-depth conversations with healthcare providers and those connections, and establish with a provider versus an on-site 15-minute biometric screening that's going to give you just a snippet. So everything you're saying is really cool, that it's aligned in the trend report, and we're hearing that across the board.
Yeah, the only thing I wanted to also kind of make note of as far as preventative care, one thing that we just did in June, which was like the first time we've ever done it. We always focus on preventative care for June, but we actually brought in a dermatologist just because we've never talked about skin cancer and just skin health awareness. So we brought in a dermatologist from Optima Dermatology. It wasn't necessarily to just promote Optima and getting patients in their door, but really just to have a dermatologist come in, talk about skin checks. What does that look like? Because a lot of people put that off because it's a little scary, they don't know exactly what to expect from those appointments. So she just talked about, this is what happens during an exam. I do this 100 times a week, like totally normal, like head to toe, just kind of went through what that visit would look like. And then we had a 15-minute Q&A session at the end. And I had probably 15 employees after that session say, I just scheduled my first appointment for a dermatologist. Never would have thought about doing that. It's just been on like the to-do list, or, you put it off until you're maybe in your 40s or 50s, but it was just something that just kind of bringing the education of the importance of it. Unfortunately, it was like right when summer started, so we didn't want to like scare people for summer, but also just to bring that education that it is so important to, not just think about your traditional annual exams, your dental exams, but really bringing in dermatology and nutrition as well. So just working with a dietitian, we've kind of incorporated those in with our preventative care kind of education.
I love that. I always think it's like it's the wraparound care for employees, right? It's like all of the holistic aspect of it. So yeah, those are all really great tips.
Do we want to maybe shift gears a little
Mhm.
bit?
Yeah.
I would say, okay, so when I brought this idea to Jessica 2 years ago, it was because the number one question I was getting from organizations that I was talking to is, what are other organizations doing for incentives? What do they see for participation? What are they doing for initiatives? And I had my own database and what I saw, and sometimes I actually end up working with clients and I don't even know what their incentives are. I help them with their program and help them with their software, and I don't even know what they're doing on the back end. So I really, Jessica and I talked about this could be valuable information as benchmarking, and especially when we talk to wellness professionals who have to go back up to leadership and say this is what others are doing for incentives and the kind of participation we are seeing. So we have some numbers, and I think they're interesting. I kind of feel like they came in a little higher even than I think I see on a day-to-day basis. But when we averaged everything out, the average incentive rate we saw this year was $610 per employee annually is allocated towards incentives. And the number one incentive offering we were seeing was cash and gift cards, followed by premium discount. And then I know Jessica and I both were really curious, do higher incentives drive higher participation? And we did work out some of the numbers and look, and we do see a bit of a correlation. There was higher participation rates for 500 and over at 49%, and 39% for under 500. And then overall participation, we came to 43%. We didn't really put definitions upon that. We let the respondents define it themselves. But at least it kind of gave us an idea. And then of course we were looking for fun incentive ideas. So that's the data that we have, but we really want to hear from real organizations. What works to motivate employees? Is it incentives? Is it a combination of other things? You guys have a ton of experience. If you could weigh in and on advice and best practices for others, we would love that.
Yeah, I would say we're probably at about 50% participation as far as the Motion Connected platform and just kind of what we offer staff. But as far as incentives are concerned, we really only do a raffle once a month for a $50 gift card. So we take one of the activities that are on the scorecard for the year. And like I mentioned, June, we focused on preventative care. So it was any employee who, completes one of the preventative care items. So it was either scheduling your annual exam, a dental cleaning, dietitian, or a dermatology appointment, you would be entered into the raffle for that $50 gift card. We probably could increase that to a couple of $50 gift cards, but just the one seems to be working just fine, just to get people motivated to log into Motion Connected, to look at the scorecard, to complete the activity for the month. I think because most of the Motion Connected activities are pretty short and sweet, they're going to take just a couple of minutes to complete or enter in something, watch a quick video. They're more apt to actually follow through with them. And then I just pull that report at the end of the month and use the random name wheel online and just randomly pick a winner and then announce that to staff in the next newsletter. So that seems to be working just fine for incentives. And then at the end of the year, we do the annual raffle for the scorecard. So anyone who is who's made it to gold to silver and to bronze, they all get entered into a raffle as well. And we end up giving away over $3,500 in Amazon gift cards. So that is a big one. I think just seeing that number and kind of one big, at the end of the year, we give out over $3,500. That's enough for people to try to kind of work through their scorecard throughout the year. Then those monthly raffles kind of help along the way of making sure they're consistently going in. But that is all we do. It comes out to about $4,100 a year for gift cards that we give out. And that's it. We kind of moved away from other incentives or just sending out a lot of swag. And, I think people just have enough little things, and Amazon gift card, just saying that in the newsletter is enough to just draw their attention, and they're kind of sold because it's something that everybody can use. So that is it. That's all we have, $4,100 for the year. Hoping to increase that a little bit, but that's driving engagement just fine for us right now.
And how large is your population, Alicia?
We have just under 5,000 employees, full-time employees.
An incredible story. There's definitely other things that go into high engagement that your team does well. I don't know if you want to talk about that, but I think leadership support and communication seem to help with your engagement quite a bit.
Yeah, I think the monthly newsletter is big. That is kind of our main communication source for just all of our monthly initiatives. That monthly raffle that we have, any events that we have going on, is all kind of housed in our newsletter, which is super helpful just to kind of draw attention and kind of get the word out about what we have. And then Teams. I don't know if a lot of other organizations utilize Teams, but we have a lot of different communities within Teams. I lead the exercise and wellness community, where we have, right now, I think we have like 1,200 employees in that community. And that's where I promote so much of our stuff, because I have just full, I guess, ownership of that community and kind of what gets pushed out. So it's a great way to build a sense of community, a culture, share initiatives that we have going on, answer employee questions where it's right there, it's quick, it's easy. It's just a good communication channel for us, and it's a large group of people who are already interested in health and wellness because they join that community, and they're there kind of seeking that information. So I use that as probably my main vehicle of getting information out for staff.
I'd love to hear, Linda, what you see other employers do, but I definitely also love to hear, Erin, if you want to weigh in on incentives or participation.
We see a variety of things, it definitely varies from employer to employer. And I think Bellin, Amplify Health have tried some different things too. I think that we're seeing all sorts of different things being used. And I think some of it is just an organization doing some trial and error, kind of seeing what speaks to employees. The other thing I just would encourage is that if you don't know what your employees want, ask them what would be most valuable to them, because for some people it may be a day off, and for other people it may be a gift card. And then you can kind of gauge your programming and your incentives around that. I think we're still seeing a very high amount of people that have that incentive based healthcare cost. So your premium being based upon if you're fulfilling the requirements of whatever that happens to be for your organization. So it's kind of a win-win to be able to get people to seek, again, their preventative care and get their screenings, and then also get a financial incentive because of it. So I think that's probably the number one thing that we see. But it's a little bit all over the board. Some folks want a free lunch and some don't. So you have to ask your populations really, really what they're interested in.
That was a great tip.
And I would add that Kohler has asked, and we've gotten everything. So we really do try to offer something for everyone. At the core of our incentive structure, we do have 2 reward programs. one that's based on a medical contribution discount or a premium discount. That's for our associates, and their spouse or domestic partner can earn it. So it basically doubles. So we're really working towards making healthcare more affordable for our people. The second reward is taxable income. So they can earn up to a certain dollar amount over the year. It's timed throughout the year because we want to focus on sustained engagement. We don't want people coming into our wellness platform one time a year, earning all the incentives, and then moving on. So that's been in existence for a few years. But we also do some of the things that people are asking for us. We do still have people that really love Kohler apparel and tchotchke. So we do a lot of raffles during our challenges that we host during the year. We have sweepstakes that happen for gift cards. But I would say the biggest change that we're planning to make for next year, and this is a little look behind the curtain, is we launched a global recognition platform this year. And so my goal strategically is to take away the fluff. I don't know how else to say it, but I'm really trying to make a concerted effort to get people back to our other point solutions. So I am going to take away the watch a video, the self-attesting or self-reporting. We are going to get people back to the point solutions that we have so many and valuable options, but people aren't always navigating there. And so as part of our benefits navigation that we have, I'm going to be routing them to the many benefits that we have access to, both for the healthy and those that are experiencing chronic conditions or issues. And then we're also going to be providing points to our recognition platform. So rather than earning the taxable income, you're going to earn points. That's going to be, you can access and redeem those on the recognition platform. So again, routing people back to a point solution that we're already trying to lift and promote and get people engaged in. So that's a big strategic change for us, is really focusing on our point solutions rather than all the other noise that sometimes we build into our wellness programs because we think it's the right thing to do. But to step back and look at where your investments are, that to me is exciting for me for next year. But we'll have some noise, and we'll work through that noise.
Yeah. The change always creates noise, right?
Yep.
So I think a good kind of closing, and Erin kind of alluded to that, is like, where do you want to grow next year in this space? So where are you trending? What are you looking at implementing that you haven't, or what's an area you're going to start investing more in time or financially? Kind of what's coming up for your organization in terms of employee well-being?
I think a big thing for us is the continuing work in terms of our population health emphasis, which ties in with social determinants of health. So in our business health department, we really are working so hard to work with employers to know their populations and to know where those risk factors are, so that they can then be proactive and offer programming that can really, really impact their population. So just helping them do things like having roster management so they can see who is due for a screening that maybe we could give a phone call to, or who is at risk for transportation, for housing, for nutritious food, those types of things, so that they're able to really say, hey, we as an organization can do something about this, because we all know that happy, healthy employees are better employees in terms of productivity and what they bring to a workplace. So it's really a win-win when we have organizations that want to dig into that data with us. And I think that's an area of our business that just continues to grow, that we're just going to keep really, really working on.
Yeah, I would say this is my own vision for the future. Probably haven't shared this with my company or got the approval quite yet, but one thing that I'm really focused on is just communication. I feel like as a fully remote, pretty much primarily fully remote company, communication is still just one of those biggest roadblocks that we have. And I'm kind of realizing that leadership buy-in is essential for the growth in our wellness space. middle managers are the ones that really have that touch point with employees. Employees are going to them if they have a concern, if they have questions, if they need resources. They're not necessarily reaching out to me in HR. They're really just going to that middle management person, their leader directly. So really just making sure managers are a little bit more equipped with being able to care for their employees, being aware of the resources that are available, encouraging the use of the resources that we have available. So kind of like that mix of communication with that leadership buy-in, really just to make sure that we are fully reaching all of our employees, and just, having as much promotion as we can throughout the company. So that's my goal and my vision, and I hope we can continue to try to move the dial a little bit in that direction.
Yeah, that's really good insight, especially from a remote or fully remote organization. Is there anything you wanted to add, Erin, to your piece?
Yeah, I mean, as I mentioned, benefit point solutions, rerouting people to that is a big focus of mine when it comes to the very structure and strategy. But outside of that, this year we had a big focus on blue zones. If you're not familiar, highly recommend, and the Power 9 principles around those. So I took those, and that is how I created my monthly focus. For next year, I'm toying with the idea of focusing on SDOH, which Linda helped clarify the acronym, social determinants of health. I just think that it helps create more empathy and awareness. And so if we can create more empathy and awareness within our organizations and our communities and within ourselves, we create better human beings. And so SDOH is something I'm very passionate about. And if you can bring more light to it, create programming around it, whether it's education, awareness, events, initiatives, new vendor partnerships, even, all of that is going to get you to a better place with your well-being strategy.
Awesome. Well, I think we're kind of right on time. And like I said, I could go on forever and pick your brains and hear about the work that you're doing. But I really appreciate all of your insight. This has been just so insightful to hear the work that you're doing and championing out in your workplaces. So thank you for being a part of this. Thank you to Motion Connected for always being such an engaging and wonderful partner for the Wellness Council of Wisconsin. We will be sharing these trend report data again at our conference, just like we did last year, to kind of continue to bring these insights to both of our communities and populations. Is there anything you want to add?
No, just thank you all. I know I took away some really great takeaways from all three of you. It's just fantastic what you do and have accomplished, and we look forward to keeping this conversation going.
Agreed.
Thank you.
Awesome. Thank you.